Five.
Hey guys, it's Dr. Emer. It's been a long day. You've been following us. We were at surgery this morning and we had patients this afternoon. Now we're doing a training night. And I have one of my good friends here who's had barely anything done. It's hard to even convince her to come and get something done. But given that she's already very young looking and she just has very small tweaks that we want to work, I'm convincing her to do a little bit of preventative maintenance in female facial shaping. So all we're going to do for her is very rarely, and you guys know, do I fill a fold. Because fillers are now used for shaping and for dimension of the face and lifting. But she already looks great. She's nice chin, nice cheeks. I just want to soften kind of around the mouth and then balance that with what we're going to do with the lips. One of my favorite new fillers is Juvederm Velour, and you guys can see it. It's a mixture of actually two types of fillers in one, a lifting filler and a softening filler. So you actually get the ability to lift if you want with the softness and look of something that's subtle, which I love. So we're gonna focus on just a little to her fold, and this is going old school, back to 2006 when I started doing filler training sessions in New York, and we were doing folds and little bits and lips. We're just doing very subtle bits, a really small needle. Like I said, back to the basic, little linear threads right on the fold. And this is gonna make a substantial difference for her because she has never had anything here before. Okay, and if you look, you guys, that's about not even a half a syringe. Look at one side versus the other. Now I'm gonna come to the opposite side. How was that? Was it okay? Okay, you're doing great. I know it's not the best feeling in the world, but just doing a very small bit right into the fold. Now, of course, we can do cheek elevation and we can do around the corners of her mouth and everything, but I just want her to feel comfortable with the starting point of doing this, something soft and natural. So we're using velour. I love this because it lasts up to a year, sometimes even longer. Great, and now what I'm gonna do is I'm gonna use velour now in her lower lip and up in the lip, central part of the lip to get balance. So we're gonna do a pillar technique. This doesn't feel the best compared to the folds, but we're gonna do very little, okay? She's super nervous, I want it to look good. So what we're gonna do is just very subtle bits into the lower, and we're keeping it central. Okay, I'm gonna come out to the opposite side and do my little filler dance. Sorry, Courtney over there.
You're fine.
Okay, very little. Doing great. Okay, that's a nice subtle approach. Okay, now we're gonna go to the upper. Now she already has like a really nice elevation here and definition. So what we need to do is create this structure. Deep breath. Good, very little right at the border. Same thing on this side, very little right at the border. I know. Bear with me. And then we're gonna do a little version of the edge, and I know everybody bleeds. We'll get that in a second. Hold on. I have a little alcohol in here, so it's making it look like it's worse, but it's not. And again, another little pillar right at the border. Good. We're going to do that on the opposite side. Be very conservative. Okay. And this is a forward technique so that you don't get projection, it just looks lifted. Okay. Now I'm gonna let that sit a second. I'm gonna go back now to the fold, do a little bit more, because we only did, I think, a half total, so I'm just gonna do a little bit more. And then we're gonna go right under the lip. I'll show you guys in a second. Get the tear in her eyes if you guys don't mind. Everybody always tears when they do lips. It doesn't matter who they are, it just happens. It's like instinctive, the body. Now we're gonna do this lower cutaneous lip. Her chin is great, but what happens is right through here, you lose a little volume, and that makes the lip actually kind of cave in on itself. And by balancing this with the chin, you see a much more natural look. Why do you think all the celebs look so good from the side when they take all their pictures and everything nowadays? It's because they have all balancing here around their mouth. So almost done.
Carrie is asking what type of numbing we use.
It's a cream, a numbing cream. I try not to do nerve blocks. You can come on that side, because I find it alters the shape of the chin and the lip. You're almost done, I promise. It looks really good. Gonna love it. She's so good. And you guys, we're just doing very small amounts in this lower cutaneous lip where, again, there's volume loss as we age. It's just gonna blend her chin. It's gonna help her corners of her mouth, even though I'm not injecting them. Okay, and then last couple pokes and we're done. And I'll let her look at her lip, and if she feels she wants a little more, we can, but I think she wanted really subtle, so that was my goal.
Should the patient expect bruising after?
Well, remember, anytime there's a needle, you guys, there's a potential for bruise. But probably minimal. I don't think there's really much perfect that I notice here. So let me show her really quick. Where's that? Here we go. Let me show her really quick just the little bit that we did and see what she thinks. What do you think?
Excellent.
So any more than that, or is that good?
No, this is plenty.
So balance the lower, did a little bit right through here. I didn't touch the edge at all, and then I just softened around. What do you think?
Perfect.
I think it's great. And then the one thing I did do is give a little teeny bit of definition in the pillar so that it lifts it up.
Great.
But you guys, this is very good because it's subtle and natural. She can always add more. Give it a couple weeks, let the swelling go down, and we'll take a look. And that's it. Bye, guys. I think that